you all for coming. For those of you who don't know me, my name is Arthur Bergeron. I'm an attorney at Myrick O'Connell. There are 70 of us at Myrick O'Connell. There are about 40 in Worcester, 20 over in Westborough, which is where I am, and then 10 in Boston. Because there are so many, I think we're the largest firm outside of Boston now, actually. But because there are so many of us, everybody gets to specialize. And so I get to do nothing but elder law, which is what I like because I'm old, so my clients still think I'm young. I like that part. So if you've been here before, you know, or if you haven't been, you haven't met my friends Frank and Mary and their kids, Peter, Paul, and Mary Jr. I always use them as my examples in terms of dealing with senior issues. I always tell people, if you get the joke about Peter, Paul, and Mary Jr., you're old enough to be my client. So the question for these folks is, you know, what their goal is, they want to stay in their house until they die. They want to be buried in the backyard. That's their goal. When they die, they want to leave things to their kids. In the meantime, they want to stay healthy. They don't want to move. And we often talk about other issues here, issues related to nursing homes, issues related to all kinds of stuff. But today, we're specifically going to talk about if Frank and Mary are retired, and they, like most folks, are on Medicare, is Medicare going to take care of Mary or Frank? But we're just going to talk about Mary. So to understand that, you need to kind of understand Medicare. And who knows about this stuff, right? I mean, you know you're on it, and you get these things, and every once in a while you get notices and stuff. But I want to talk about that a little bit. I want to talk a little bit briefly about Medicare A and B. And my good friend Christine Alessandro is with me, the executive director of Baypath Elder Services. They're our co-sponsor in this. If you folks, if everybody here heard of Baypath Elder Services, raise your hand. Oh, if you haven't, you should. And if you're a senior, this is an ad now for Christine, you need to just give them a call at some point. Just give them a call and find out what kinds of programs they have available for you as a senior, because they may very well have stuff available to you, even if you don't think you really need anything. And that way, they know who you are, so that if you end up needing more things later on, like you're already in the system, so it's easier to deal with it. So I would strongly suggest that. So a brief history of Medicare. What we think of as Medicare is really Medicare A and B. Medicare A and Medicare B. These were both adopted in the 1960s during the time of Lyndon Johnson. You know, some of us are old enough to remember Lyndon Johnson, right? So to understand the effect of Medicare, because younger people don't get this, you have to understand. So Medicare was created in 65. In 1960, 33% of seniors were poor. Today, about 7% of seniors are poor. Now remember, 33% of seniors were poor, and Social Security had already been there for 30 years when Medicare was adopted. And the reason is because most seniors, of course, they get old, they lose their health insurance, and if you got sick, you got poor. That was just the way it was. So Medicare has totally kind of revolutionized the life of seniors, which is really fundamental. So to understand the basics of Medicare, to enroll, you have to be 65 or older, unless you're disabled. You have to have put in money into the system. You have to have paid in officially 40 quarters, although you can buy in if you didn't put enough money into the system, and that's kind of how you get in. And then the question, and then if you get in, we're not going to talk about Medicare D, although Brian is going to talk a little bit about it, because Brian, whom I didn't introduce, Brian's from Fallon. So there are a set of large insurers, health insurers, that provide both supplemental policies to Medicare A and B and also provide these alternatives called Medicare C, and that's what I wanted to give you an example of one that actually did this stuff, so that's why I asked Brian to come over from Fallon. So I'm going to talk a little bit about Medicare A and Medicare B. What is the difference? Medicare A, which is paid like entirely from those subtractions from your income, which you paid all of that time while you were in the process of getting to be the advanced age that we are now, right? Medicare A provides a set of benefits. Hospital, you walk in the hospital, you're sick. Medicare A is paying for the hospital. Nursing home, you probably have heard of the fact that you have like kind of limited nursing home coverage. We're going to talk about that. Homebound care, which we're going to talk about briefly, and also hospice. Hospital. Medicare actually pays the hospital bill. But the question is kind of like, so how much does it pay? So it pays, first of all, when you go to the hospital for a stay, once you've been admitted to the hospital, there's a deductible. That's the current deductible. By the way, I did my slides before I talked to Brian, who reminded me that in 2019, some of the numbers changed. So these are the correct numbers, or if they're not, Brian's at fault. The numbers that you have in your handout may be a few dollars lower than this, but this is very close. So if you're on A and you go to the hospital, your deductible at the hospital is $1,384. Your next 90 days, I had thought was free, although I thought you had indicated to me that, is there a copay during the first 90 days at the hospital?
If you're on a Medicare Advantage plan?
No, if you're just on straight Medicare.
If it's just straight Medicare, then it's an 80-20 deal.
Yeah, so even during those first days at the hospital, after you're in, basically the way the system works is that the hospital sends a bill to Medicare and says, here's how much our official rate is. And Medicare says, well, that's what your official rate is, but here's what the rate should be, the ordinary and the appropriate rate for that hospital. And whatever that is, we're going to pay 80% of that, 80% of that, and then you folks are going to pay the other 20%. After that, you get another 30 days of hospital care with still that 80-20, but also with a copay, a $344 per day copay. You have 60 lifetime reserve days after that with that copay, $682 per day. And remember that whenever you're going in for the first time, whenever you're going into the hospital, the question is this a new illness? So if you've been to the hospital, gotten out of the hospital and also out of the nursing home, if you were on rehab, and at least 60 days have gone by, the clock resets, it's a new period of illness, and so you get your new 60 days all over again. So there's a hospital system that pays you. Then there's a nursing home benefit. You often, and I'm going to take all questions at the end, just because I want to make sure we kind of get through all this. There's a nursing home benefit. Many folks are aware of that in the context of doing kind of nursing home related planning. So if you have been admitted to the hospital, and you have to have been admitted for a period of 3 days, and then you go directly from the hospital to a nursing home, then Medicare will pay for as many as 100 days of skilled care in the nursing home as you need, or as many days until you stop requiring skilled care. Medicare does not pay for your stay at the nursing home unless it can be established that you have to be at a nursing home. That is, that you need nurses regularly. The median number of days that Medicare pays at a nursing home is 17. Although they're allowed to pay as much as 100, because most people fall off of that standard requiring the skilled care. If you need skilled care according to Medicare if you need a nurse, physical therapist, occupational therapist. Once again, no more than 100 days. There's a home care benefit. Most people are not aware of this. They assume that in order to be on Medicare, you need to have gone to the hospital and be kind of recovering. That's not the case. If your doctor certifies that you are homebound, you have to be homebound. And by the way, that means you don't want to, I had this case that happened, you don't want to be getting a certification that you're homebound so you're getting your benefit, and then the nurse sees you at the Dunkin' Donuts a few weeks later in the line. No, it doesn't work. So you have to really be homebound. If that is the case, and the doctor prescribes for a 60-day period the kinds of things that you need while you're homebound, and they are skilled services, then Medicare pays for that. And that can happen an infinite number of times. Now, there has to be a doctor's plan of care. The services that are required need to be skilled, and I'm not going to talk about GMO today. The benefits, once again, you can stay at home, and that benefit actually can last forever. There is an assumption that these benefits at home run out after a given number of days, but as long as your doctor keeps recertifying that you can be there, you can keep on getting them. Hospice. I always talk about hospice because people always assume that hospice is like, this is the last 2 days before I die. Hospice is a benefit that provides a substantial amount of assistance, not only palliative care to make every day be as good as they can be, as well as counseling, a whole bunch of services for folks. If your doctor has said that he thinks or she thinks that you may die in the next 6 months, given kind of where you are in terms of what your health is. It doesn't run out after 6 months. If you haven't died, you don't have to give them like a reimbursement or anything, right? And that benefit can actually continue to be extended. It can be extended kind of an infinite number of times in these kinds of 6-month increments. I've had folks on hospice, and as a matter of fact, one figure I heard was that something like 28% of people graduate from hospice. I thought that meant you're dead. No, it meant that you stopped being on hospice and you got better and you went back home. And so it's a terrific benefit. And don't wait until you're almost dead. This program isn't about hospice. I think we may do one about hospice just to kind of talk about that stuff. Once again, requirement, you need a doctor's certification that you may die within the next six months. It's renewable forever. So that's Medicare A. Those are the 4 benefits. Everything else you get from Medicare is Medicare B, if you're on plain, what is called traditional Medicare. Medicare B covers kind of like everything else you can think of. It is the monthly check that gets subtracted from your Social Security check goes to pay for your Medicare B. There is actually a payment for that. If your income is substantial, if I recall correctly, substantial if you're a married couple means over 100.
It's 85 for a single.
If it's over $85,000 a year for a single and
170.
And about 170 for a couple. So if it's really high, then this Medicare, this monthly payment goes up. But for most folks, that's kind of the number that you see. It's now $135.50. Then, when you get a benefit, whatever that is, whether it is for the folks that are taking care of you in the hospital, even your doctor. If your doctor is going to the hospital and seeing you there, his bill is a Medicare B bill. It's not a Medicare A bill. The physical therapist afterwards, the kind of just everything else. The basic system is people will give you this care, submit a bill to Medicare. Medicare will say, whatever that was is fine, but we're going to decide what is the reasonable charge for that care, and then we're going to pay 80% of that. And then there is a balanced billing requirement here in Massachusetts so that you can be charged for the other 20%. The person who provided the services can't charge you any more than that. That's the basic system. So it's always 80-20. What is covered? You know, everything you can think of. Physicians and x-rays and splints and durable medical equipment, all of the stuff that you think, medical nutrition therapy, there's a whole bunch of things that are provided under Medicare B. The things you don't get, immunizations, eyeglasses, most dental, any kind of custodial care. Any kind of custodial care. If you're looking even at home for care by someone who was not giving you skilled care, think nurse, physical therapist, occupational therapist, then chances are it's not getting covered. So as I've gone through with Medicare A and with Medicare B, you can see, even though you've got the insurance, it's kind of like what your health insurance was before you retired. There's more things to pay, right? In the case of Medicare B, there's a regular monthly payment. And then no matter what you're getting, typically there is a deductible, or there's often a deductible at the beginning, and there's always a copay, or pretty much always a copay. So when you think of when I was younger, I was referred to them as MedX policies, but apparently that's one insurance company that gives MedX. But when you think of policies in addition to Medicare, what you've typically been thinking about are so-called Medigap policies. These are policies that are paying that stuff. You're buying extra insurance to pay for the deductibles, the copays, the things that your regular traditional Medicare is not paying for. Right? And you're making that deal with a separate insurer, and you're able to change insurers every year, and that's kind of what a Medigap policy is. I remember doing a presentation related to this last year, and I remember there was somebody sitting like over here, And I said, come back in the spring, because he was talking about, but he had this question about, he thought when we were talking about Medicare C, that we were talking about what he had, which was one of these Medigap policies. Then there is Medicare C. And so Medicare C broadly was designed to basically provide an alternative to traditional Medicare, provided by insurance companies who are required under the terms of the insurance deal to provide all of the care, all of the benefits that Medicare A and B provide, but with some limitations regarding who you can go see, and perhaps with some additions to what you can get under the package. That's Medicare C. So before we decided to do this presentation, I was thinking about, so how many people are actually in Medicare C now? Because typically when I talk to folks, they are always talking about Medicare A and B. But I just read like 2 weeks ago in the New York Times that something like 1/3 of all the people in the country now who are on Medicare are on Medicare C. And something like 25% of the people who are in Massachusetts are on Medicare C, right? And what I found amazing about that is that most of the people who aren't on Medicare C haven't heard of it, or haven't even considered being on Medicare C, which is one of the reasons why we wanted to talk about it. Now, Christine and I came last fall to talk about it because Christine was talking about the fact that Medicare had actually changed their regulations in order to expand some of the things that can be offered by Medicare C. So I wanted Christine to talk a little bit about that, right? Because that was brand new. The Medicare only started allowing this like January 1st, right? And talk about what can be offered. And then I wanted to find somebody from one of the main companies that does this. So, there are a ton of insurers, but not really, So there were, in Massachusetts, there were like 5 big ones. And I'll see if I get them. So there's Fallon, there's Blue Cross, there's Harvard Pilgrim, there's Tufts, there's Health New England. Western Mass, which isn't around here. Right. So I wasn't really missing it. It's just that I never go to Western Mass. So around here, there were really 4 plans. So I wanted you to hear from one of them. As it happens, in this area, they're actually the biggest, closer to Boston, a couple of the others are, right? So that you could get a sense of how, first of all, I'm talking about what the Medigap plans are, and then contrasting them to Medicare C so that you can have a chance to look at this, because in regular open enrollment, as you well know if you're on Medicare, isn't now. It isn't going to be until the fall, but we wanted to give people a sense of all of this stuff, and then we're going to talk about that a little bit more afterwards. So, first, Christine, thank you very much for coming again, and we really appreciate it.
Thank you.
Oh, that's right. This is my high-tech lesson. That's forward, that's back.
Okay, I think
After that, you got to ask him. Right. Okay? Good. Thank you.
Well, good afternoon, everyone, and thank you for having me again. It's great to see you on this beautiful 50-degree day outside, and I'm so glad that the snow is going away. So I'm here to talk very briefly about some changes to Medicare Advantage plans, but you're going to hear the real dirt from Brian. Now, with Medicare Advantage, you always had a choice before. You always have a choice now. You have regular fee-for-service Medicare, or you could go to a Medicare Advantage plan. Medicare Advantage, as Arthur said, is called a C plan. You receive your Part A and Part B from the insurance company, but there's some added extras, such as perhaps dental, perhaps eyeglasses, perhaps pharmaceuticals. It depends on the insurance plan. But they're becoming much more prevalent nowadays. And as Aetna is also in the mix. Aetna, okay. So, and if you're in the West, there's a health plan out West too. Basically, Blue Cross Blue Shield, Fallon, Harvard Pilgrim, Tufts, the usual suspects, as I say. Currently, some of the Medicare Advantage plans offer limited supplemental benefits, and these are not covered by original Medicare. That is primarily health-related, and for which the Medicare Advantage plan must incur a direct medical cost. Now, you know, if you are on regular Medicare, and my mother is on regular Medicare, she's on Medicare fee for service. She lives in New Jersey. And so when she gets sick, I have to go down and lend a caring hand because I'm the long distance caregiver. And
Designated daughter.
the designated daughter, that's me. And back in December, I was down there, my mother had a problem, and this was just at the tail end of open enrollment, and we were talking about getting her a care manager because she's starting to have some difficulties. And I said, Mom, why don't you consider a Medicare Advantage plan? And she said, well, what's that? I said, well, you can do fee-for-service Medicare, which you're in, or these other programs, more like a managed care program where you might be able to get, say, dental. And she went, really? I never knew about that. But it was only 2 days left in open enrollment, so we couldn't get her together enough to get her enrolled. So previously, CMS, the Centers for Medicare and Medicaid Services, had not allowed items or services to be eligible for supplemental benefits. For example, Bay Path Elder Services, we provide in-home services to older adults, so you may be able to get personal care. Personal care is someone assisting you with bathing, showering. It's not a home health aid level of service, but it's someone who might assist you in washing your back or washing your hair. Medicare does not cover that. You could get a home health aid if you were frail enough under a Medicare benefit, but you couldn't get personal care. But under the revisions which are taking place this year, you can get certain supplemental benefits if they're used to diagnose, prevent, or treat an illness or injury, compensate for physical impairments, act to ameliorate the functional psychological impact of injuries or health conditions, or to reduce avoidable emergency and healthcare utilization. Think about that. You could get something very simple that is not a piece of durable medical equipment in your house to help you avoid a rehospitalization. My mother has chronic obstructive pulmonary disease, COPD, and it's very hard for her to breathe. In New Jersey, it's a lot more humid than it is in Massachusetts, and if she did not have air conditioning, she would be back and forth to the hospital. Well, she has a condo that has air conditioning, central air. But if she didn't have that air conditioning, she would be much more susceptible to going back to the hospital, which means a very costly admission. Medicare has finally woken up and said, you know, we can do some little things that can enhance the quality of life and reduce these readmissions, because that's what healthcare is about, reducing the readmissions. So, non-skilled in-home supports can be included as a benefit under Medicare if your doctor prescribes, such as a wheelchair ramp. I can't tell you how many times individuals that we serve in our home care program could really benefit from a wheelchair ramp. We have husbands carrying their wives up and down stairs because they can't afford a ramp, and that's dangerous. Transportation to medical appointments. This is one reason, huge reason, that people have a readmission is they don't get back to see their doctor within 7 days. Air conditioners for asthma, personal care, activities of daily living. If you can't take appropriate care of yourself, you may be susceptible to skin breakdown, to pressure ulcers. You might include adult day health or even healthier groceries. Sometimes on a very limited income, you can't afford the good food for you. So that's why having better nutrition helps prevent illness and disease and helps you keep well. So, will it be covered? Your doctor has to make that determination. It's slow to be implemented this year. Things with the federal government, we know, change very, very slowly, but this is coming. So, I encourage you, bring this up to your medical provider if you have this need, and see if you can advocate for yourself to get these changes. So expect confusion. This is a big change for plans. Very, very big change. And we can help. BayPath can help. We already contract with providers for personal care, homemaking services, so we can help guide you along the way. But the important thing to remember is that there's an expanded benefit under Medicare Advantage plans only. Not regular Medicare, Medicare Advantage plans. And that brings me to introduce this fabulous guy who's going to talk to you about Medicare Advantage. Here's Brian.
Thank you. Hello, how are you? So I am the, thank you, Arthur, and thank you, Christine. Appreciate it. I'll show them a couple of things. Thank you. So I am the Fallon Senior Plan sales executive for Massachusetts west of 495. There are 5 counties, and Worcester County is my primary county. I go to approximately 31 senior centers in my territory, and I do Medicare 101s, and I do Medicare Advantage, and member meetings and sales presentations. Especially during open enrollment, I do area presentations at senior centers to talk about the plan offerings we offer. So Christine and Arthur talked about Medicare Advantage and what it does. I just wanted to touch on a couple of things, add to a couple of things you talked about. So Medicare Supplement, or Medigap, is very similar in the 80-20 situation that Arthur explained earlier. The only difference would be that if you were on a Medigap or Medicare Supplement plan with Fallon Senior Plan or any other carrier, the doctor would bill the government their 80%, and then the 20% would come back to us, and we would pay that. So I think Arthur mentioned that, but I wanted to clarify that so you understood that's how that worked. And then there would be, depending on the plan you had, there would be those deductibles for inpatient hospitalization if you had that plan.
Ryan,
But
you
yes,
probably
sir.
want to kind of keep to the left a little bit, just so that you're not eating up Frank and Mary. Is that all right?
Yeah, my big body. Sorry,
Is that all right?
like an eclipse. So we're here to talk about Medicare Advantage. So Medicare Advantage, Arthur was really great to talk about Medicare A and B. You need to have Medicare A and B in order to have Medicare C, which is a Medicare Advantage plan. Medicare D is drugs. I always say D equals drugs, and that's included in most of the Medicare Advantage plans that carriers offer to you. On Fallon Senior Plan, I can only talk about Fallon Senior Plan. I can't talk about Tufts or any of our competitors. I can just tell you a little bit about our plan. So this is our what we call benefits at a glance for Worcester and Franklin counties. There are 6 plans we offer here in Northborough and in Worcester County. Our least expensive plan is a $0 premium plan, so you're not paying anything for that premium. There are co-pays for just about everything else that you would pay for, and we have 5 other plans all the way up to $275. That's our most expensive plan we offer. Now, just like anything else in life, the more you pay on the front end, the less you're going to pay on the back end for your co-pays. So, for example, the $275 plan has a $10 office visit co-pay for primary care physician visits, whereas the $0 plan has a $20 co-pay. That's how that works. Now, Medicare Advantage plans. Arthur did a really great job of talking about how they work. What I like to tell people is we kind of just ask the government to go away. We say if someone enrolls on a Medicare Advantage plan, it's an HMO plan, and there are co-pays, and there's a monthly premium, but there's not that 80-20 component. So the 80% that the government pays and the 20% that you pay or that we pay, that goes away. That goes away altogether. So we tell the government, kind of go away. We're going to take care of Arthur, or for example, he's going to enroll in our Medicare Advantage plan, and he's going to pay us a monthly premium as long as he doesn't have the $0 premium plan, and then we're going to pay those bills. So the bills would actually go, instead of going from the provider to the government, that bill would come directly to Fallon Senior Plan, and we would pay the bill. Arthur did a really great job talking about usual and customary payments, and that's what we pay. We contract with all these providers in our network to pay claims, and that's what we do for you. So you don't have to worry about paying 20% of anything. You just have co-pays for certain responsibilities for certain services. So that's how that works. Medicare Advantage, there is an annual enrollment period every year. For those of you who are already enrolled on the plan, you can change your plan during that time, or you can come off of it or switch it. That's from October 15th to December 7th. That's when the rubber hits the road for me. I become very busy. I do a lot of presentations, and I take applications during that time. The effective date for that period of time would be January 1 of the following year. So this year, we'll have our new plans and our new rates for the 2020 plans. It's so weird to say 2020. Oh my God. Isn't it strange? 2020. We're going to have those rates and those plans on October 1st. So that's when I'll start doing presentations. You guys will see me in Westborough and Northborough and Shrewsbury and Worcester, everywhere else. And that's when you can come learn about those plans. And that period of time, October 15th to December 7th, is the period of time when you can change your plan, okay, if you want to do that. If you don't want to change your plan, that's okay. Now, the open enrollment period is something that's new. That's completely different, and that's new starting in 2019. And the way that works is, starting this year, the government is allowing anyone enrolled on a Medicare Advantage plan already to change their plan once from January 1 all the way to March 31st. So we've got, what day is it today? We got less than a week, 25th. I believe. Yeah, thank you. Less than a week now. If you're not happy with your Medicare Advantage plan, regardless of who it's with right now, you have less than a week. You've got until midnight, March 30th, to get your change form into your carrier, or to whoever you want to change to, and you can change your plan once. So the government's kind of giving everyone a second chance, or kind of a look back for 90 days. Starting January 1, ending on March 31, to change your plan one time. So we've been busy with that this year for the first time ever. So that's called the open enrollment period, OEP. Remember, AEP, annual enrollment period, is what you have at the end of the year. If any of you are not Medicare eligible yet, and you're aging in this year, you're not really subject to that annual enrollment period. You know, at the end of the year, you would actually become enrolled when you become Medicare eligible. For example, if your birthday, if you're turning 65 this year, say in September 24th, you're actually going to be eligible for Medicare A and B on September 1st, and that's when you would be eligible, once you have A and B, to go on a Medicare Advantage plan or a Medicare supplement plan. Does that help you? Does that cover a lot of stuff? Now, Medicare Advantage plans have a lot of extra benefits. Now, I spoke with some very nice people this morning about Medicare Advantage plans, and it came up about how we're different. How is Fallon different than Blue Cross, and how is Blue Cross different? You know, how do we separate ourselves from our competition? We're all friendly competitors, you know, like or unlike any other businesses. We're supposed to be very similar as far as the way the plans work and our rates. Where we differ are the rates. You know, our rates might be a little bit different than some of our competitors, plus some of the ancillary benefits that you get, or the extra added benefits that you get with your Medicare Advantage plan, might be a little bit different. So, for example, with our plan, we have our senior plan members who are enrolled on the Medicare Advantage plan would get $150 towards their first pair of eyeglasses, and that would come off at the retail sale. And if that doesn't happen, then you would let customer service know. They would send you that $150. Now, that comes off your first pair of eyeglasses. If you choose to get a second pair of eyeglasses, we contract with iMed, which is the second largest vision service provider in the country. iMed is located with the network. It contains a lot of doctors in the area who might be on their own. It also involves 5 retail locations: Target Optical, Sears Optical, Lens Crafters, Pearl Vision, and JCPenney Optical. And that's iMed. So if you go into a big Target with an eye center, you'll see an iMed sign there. If you get a second pair of eyeglasses at iMed, you'll get 40% off of that pair. So that's one of the ancillary benefits you get. We also offer a 13 consecutive week Weight Watchers benefit for free. So whether or not you need it, if you want to use it, you would use the 13 straight weeks, as much or as little as you want, but that would be free for you. It would cost me money. I don't go, even though I should, but it would cost me money. It wouldn't cost you anything. Speaking of going to places, we have a Silver Sneakers benefit. That is where you get a free membership at any Silver Sneakers location anywhere in the country. So right up the street here, it's the only one I can think of in the area, is the Burroughs in Westborough. Very nice facility, amazing pool, very expensive, but very good. They're part of our Silver Sneakers network, so you could join there for free. Again, I would have to pay because I'm not a senior plan member, but if you were a Fallon senior plan member on the Medicare Advantage plans, you would get that Silver Sneakers benefit for free. And it's portable, so you can actually sign up there and go to any Silver Sneakers facility in the country to work out, and that's great. That's one of our benefits. Dental services. So some of our plans, 4 of our 6 plans have a dental benefit, but it's only a dental benefit. I'm very careful to tell people it's not a dental plan, it's a dental benefit, where you would get 2 oral exams a year. $25 would be your copay. That would be it. We would pay the rest. And it would have to be with a dentist that's part of the Fallon Senior Plan Network for cleanings, fluoride treatments, and bite wing x-rays. So more of the preventative type things. Okay. Our $0 plan that we call it our flex plan, has a reimbursement where you would get up to $180 back to see any dentist anywhere in Massachusetts to have those same services done. I should also mention that the $0 plan doesn't have the silver sneakers benefit, but it does give you a $160 cash reimbursement to join any gym in Massachusetts. That's why we call it the flex plan. We have those two reimbursements there. And again, that plan doesn't cost anything. What else am I covering here? Dental.
Talk about drugs.
Prescription coverage. Thank you very much, Arthur. So prescription coverage is offered on 5 of our 6 plans. One of our plans, called the Saver Plan, is $93 a month, does not have drug coverage because if you're a veteran and you get your drugs through the VA, you would be able to get those drugs through the VA, and you would have coverage which the government claims is creditable, which means it's as good, or your drug coverage, I should say, your prescription coverage. It's as good or better than what the government would give you. So that's one plan we offer without prescription drug coverage, but the other 5 plans do have it. Now, on our plan that's $22 a month here, our Super Saver plan, that's the plan next to the $0 plan, there's a $415 deductible. Now, there are no deductibles anywhere on the medical side of any of our 6 plans. On the prescription side is where you're going to start seeing deductibles. $415 just on this one plan means that starting January 1 or whenever your plan begins, you're going to pay the first $415 toward the retail cost of your drugs, and then copays will kick in at that point. That's just for that one $22 plan. The other 4 plans that offer prescription drugs have a deductible on certain tiers. So, for example, our $0 plan and our other plan, which is $103 a month, which is also called an HMO POS plan, that allows you to go out of network for specialty care. I'll talk about that in a second. But those 2 plans, for example, have a $300 deductible only on tiers 3, 4, and 5 prescriptions. Tiers 1 and 2 are generic. Generic means not as expensive, the least expensive drugs. For example, tier 1 is $1 for a 30-day supply at a pharmacy which is considered preferred. So CVS, Target, Stop and Shop, Walmart, for example, would be preferred pharmacies. Tier 2, another generic tier, would be a $7 copay for a 30-day supply. You're not subject to deductibles on those 2 tiers. But if you have a tier 3 drug, which is kind of a middle-of-the-road prescription, it's not as expensive as some of the others, and it's not as inexpensive as some others. It's kind of middle of the road. That's a $37 copay for a 30-day supply. But on a tier 3, 4, or 5 prescription, on these 2 plans I talked about, you have a $300 deductible, which means you're going to pay the first $300 toward the retail cost of your tier 3, 4, and 5 drugs. And once you pay that, then you start paying that $37 copay. I don't want to confuse you guys by getting into too much, but the basis of a Medicare Advantage plan is to offer prescription drugs on most of our plans, and we do that. So kind of a goofy, weird thing I say is you need to have A and B to have C, which includes D. Don't remember that. It's goofy, it's silly, it's weird, but it's true. You need A and B. One of the first questions, again, those nice people I met with this morning, first question I asked them, do you have A and B? You do? Great. You can sign up on a senior plan. If you don't, that's okay. Just let us know when you do and we can sign you up. Okay?
Talk about being in the system.
Being in the system, as far as?
There are some limitations regarding hospitals, doctors, et cetera. Right,
with the network? Yeah, okay, the network, right?
The network.
Sorry,
the wrong term.
No, that's okay. It's all good. So one of the things with a Medicare Advantage plan, as I might have mentioned, is we have a network of hospitals and doctors. This being an HMO plan, just like maybe some of the HMO plans you had or that you might have been enrolled on before you were eligible to go on a Medicare or senior plan. HMO network means that you have to name a primary care physician as the gatekeeper of your care. So this doctor's the doctor you're going to see for main situations, and they're going to dictate, can I see this doctor? They're going to let you know what yes or no. They're going to actually coordinate to have referrals sent in anytime you go to a specialist. So you have that where you have to name a primary care physician. There's also a network of hospitals, physicians, and doctors in the Fallon Senior Plan network that we have to stay with. So I tell people it's almost like being in a big gated community. We only see the doctors and the hospitals in that gated community, but our gated community for our senior plan is basically the whole state. We've got a lot of hospitals, we've got a lot of doctors, a lot of networks. I've got the hospital listing right here if anyone wants to take a look at it. It's pretty extensive. We got a lot of great hospitals in this area, in the Boston area as well. A lot of the medical centers are here as well. I will say that, and I'm going to talk a little bit about that $103 plan now. We call it the HMO POS plan. One of the networks, one of the area networks not in our HMO network for primary care right at this moment is Reliant Medical. Because at the time, 5 years ago, 6 years ago, Reliant was Fallon Clinic, and when they were purchased by Atrius Health Systems and Wellesley and turned into Reliant Medical Group, the first order of business they did was they signed an exclusive contract with one of our competitors to only have them go into their buildings. So I believe at the time there were 19. There may be 26 Reliant locations now. They're really awesome. Some of you may have received that letter 5 or 6 years ago. It wasn't a fun day for us at Fallon. So what we did was we went out, we addressed it, and we said, okay, well, this was not something we were expecting either, but we're going to create a plan called an HMO POS plan. Now, POS is an acronym for point of service. That's a component of a health insurance plan that means that you can go outside of that plan's provider network for specialty care. So we created this HMO POS plan, which is now $103 now in 2019. At this time, 5 years ago, we said, okay, well, here's an HMO POS plan that you can join, which means you can still go to Reliant Medical Group for your specialty care. You can also go to other hospitals not in our network, go to Boston, go anywhere in Massachusetts, any provider, as long as they're a specialist. And that helped a lot of people. The people who were not helped by this plan were people who had primary care physicians with Reliant. So they actually had to go to that other health insurance company, which was okay. It was a hit for us, but we're hoping someday that can all be reworked and we can welcome everyone back. That would be great. So that's where the HMO POS $103 plan is really helpful for a lot of people who might go outside of our network, outside the fence, outside of the fenced-in area or the gated community, so to speak, for any care that they have, for any specialty care. Does that help as far as the network? All right, so thank you so much for the opportunity to have me here today. I appreciate it. I recognize some faces here. I recognize an old neighbor in the back here. He put up with me when I was this tall. Yeah, I broke my finger in your driveway one time. You know that, right? No, I'm kidding. It's all good. It's all. So I just recognized him when he walked in. I'm glad to see him. So thank you so much. I'll stay for a little bit, and thank you.
So, thank you.
Thank you.
Have a seat, just for a second. So before we do questions, I just want to, obviously I wanted to make clear, so this isn't an ad for Fallon. I thought it was important, though, that you kind of see how one of these plans actually works, right? And it's a ton of details, and I would just make a couple of observations regarding those details. First, so Medicare A and B, you can stay exactly where you are, and the point of this program is just to say, that's great, but there is this other thing. There is this other thing, Medicare C. Now, once you get to Medicare C, the one thing you can be sure of is that the basic services that were provided by A and B are in that plan, because they have to be in that plan, because that's the only reason why Medicare allows it. The point, though, is there are other things that can also be in that plan, but there may be some other charges. There may be some other charges like regular insurance that you're going to pay during the year, in return for which you're going to be paying less in deductibles, less in co-pays than you were paying under Medicare A and B. There may be some specific things that are provided, and as Christine mentioned, Medicare has changed their regulations so as to expand the total number of things or kinds of things that Medicare or that these plans can provide. None of them are required to provide these additional things, but they all can. And so you're going to be seeing this continuing evolution in plans that will give you more possibilities. So think about it as, you know that you've got Medicare A and Medicare B, right? And you know how much how much that package is costing you every year in terms of your insurance, because there's that monthly payment for Medicare B, right? And you know, or you kind of know, because there's a lot of detail here, what that gets you in terms of if you actually need services, what you're going to be paying in deductible, what you're going to be paying in copay. So the challenge for you, if you are interested in that, of course you can just stay where you are. But I just wanted people to be clear on the fact that there is this other alternative which may give you more benefits. There are a number of companies that are providing stuff. They're all providing different stuff. These are all math questions. Well, they're really a combination of two things. They're a combination of math questions and risk questions. And they relate to actually something that one of the guys from Fallon told me, which I really kind of hadn't thought about, but I should because I'm 69, you know, so I'm kind of like with you on this, which is, remember, on Medicare and all these Medicare Advantage things, right? There's no pre-existing condition stuff. There's no you can be excluded. No, no, no. Everybody can apply and everybody can get into all of these plans. So the question that you want to ask yourself at the beginning of every kind of open enrollment period, right, like in every September is, so how am I feeling? Am I feeling really great, right? Am I feeling not so hot? Do I think I got operations that might be coming, like in the next year, you know? Do I think my plan may be changing, right? Because you have the ability, it's totally in your control. You have the ability, like in September, to start looking at this and saying, maybe I'll shop a little bit. Maybe I'm feeling great. And so I'm saying to myself, so why should I be paying why should I be paying or worrying about paying the kinds of deductibles and blah, 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 blah that I might have to pay? Maybe I just want to get one of these plans that just guarantees I don't want to do that. Maybe I'm not feeling so great, or I think that my drug needs might change, because most of these plans, as was pointed out, are replacing not only Medicare A and B, but also Medicare D. So what you're buying from, whichever one of these players you're buying from, you're buying insurance that's replacing what you're now paying on Medicare D for your drug plan, right? And you're replacing this possibility of deductibles, et cetera, through Medicare A and B. So I wanted you to be kind of aware of it now, and that's why we really appreciate the fact that Northborough Cable is willing to do these and to replay them. And by the way, if you're just dying to see this again, remember, in addition to watching them on Northborough Cable, my friends Frank and Mary have their own YouTube channel, Elder Law Frank and Mary, and you can go watch them there, right? So think about it. You don't have to be shopping now. You got a lot, well, unless you want to change your Medicare C plan, you got about 5 days. So forget that, right? But think about it for next fall, and don't think that you just automatically want to be re-enrolling Medicare A and B, or that you automatically want to be keeping your Medicare D drug plan.
Can
right?
I say one thing?
Think about whether, yes, and
sorry.
last comment, and then we'll take any questions.
Yeah, no, thank you. I just wanted to jump in while you were talking about that. I'd love to see you at my presentations, but please go in the fall. If you can go to some of the other presentations the other carriers offer, including Fallon. That's, again, when the rubber hits the road, when we're going to have the plans for 2020. So definitely go to those presentations. Mine is usually an hour. I usually stay another hour to answer questions and maybe fill out applications if we need to do that. But that's when all this material will make a lot of sense. That's when I'll have more time to go over plans with you at that time. The other carriers will do the same thing, but that's when you're going to really want to mark it on your calendar, maybe October 1st. You can contact some of the senior centers and find out, hey, when is the Blue Cross guy going to be here? When's the Fallon guy going to be here? Maybe you can talk with the library or inquire with the carriers themselves. They'll let you know what our calendar is.
Yeah,
but
as a matter of fact, Christina and I have also been talking about maybe even looking to host an event in one of the communities here, and maybe invite everybody at the same time.
It's a good idea.
So you can actually have all the players there, right? So you can actually be kind of talking to people. I think it'd just be a really good idea. And once again, not that that's the right answer, but the point is this is a combination of a risk issue and a math issue, and there's a lot of money involved here, right? There's a lot of money. The insurance is a little money. If you really get sick, that's a lot of money. I remember the example that I heard is the classic, the $100,000 heart attack. The $100,000 heart attack on Medicare A and B, you're paying that little deductible, and then you're paying 20% of $100,000, right? That's not nothing, right? So to think about whether you'd sleep better knowing you have a different alternative to that might be worthwhile.
I have a question for Brian.
Okay.
So,
questions from everybody else.
my mother's on Medicare A and B, and she's thinking about going on a Medicare C plan. How does she find out if her doctor is in your network?
Great question. Thank you. Our network is posted online on our website, which is hold on. Fallon Health. FallonHealth.org/senior plan, right there. You know, and I mention this usually when I meet with people. I don't like to tell people to go to the website because I know a lot of people don't use the internet, and some people don't like to. You know, I think it's bothersome and whatnot. When I started with Fallon in 2005, our provider directory, this is not a lie, was an inch thick. I used to carry the books with me to all my meetings. I'd bring 5 or 6 boxes in and hand them out. They don't even make them anymore. My first meeting this year, I believe, was in Gardner. I had some gentleman walk up to me with a big box. He said, "I want you to take this back to the office." It was 2 binders, no lie, this thick. It was our provider directory. That's how big it's grown since I've started with them 14 years ago. So the point is, we don't even print them anymore. We print them on demand because by law, we have to print them if someone wants them. If you want one, you let Fallon know, you're gonna get a big FedEx box in your kitchen. So a lot of that's going online. So our provider directory is online, so your mom can look that up from New Jersey. You can look that up, or you can call customer service. Our customer service department, I cannot say this enough, is awesome. We're in one building in Worcester, which is really great. They're on the 8th floor, and they're all really great people.
This is an ad.
Well, I mean, I'm being honest.
No, but that's good. That's fine. No,
like
but
them.
now I want to take questions.
But you can call them and ask them as well.
Okay.
Right.
Thank you.
Questions from anyone? Questions from anyone? I know that there was yes, sir.
You didn't explain the difference between Medicare and
I made an attempt, but I told him he would. And then he didn't.
I'll be
Do that.
brief with this. Medicare Advantage, we talked about, has the network of doctors and hospitals, co-payments, monthly premium. You have to follow the network. Medicare plan is an 80-20 payment situation, again, where instead of you paying the 20%, we pay it. There's no network of hospitals and doctors, and there are no co-payments. If you choose one of the 2 Medicare plans that does have deductibles, that $1,384 deductible and the $185 deductible for the other services, there's no co-payments or anything beyond that. There's also no drugs attached to either of the Medigap plans that all the carriers offer. We offer 2, Blue Cross offers 2, everyone offers 2. The one plan and the core plan, there's no drugs attached to either of those plans. So if you were to join a Medigap plan or a Medicare supplement plan, you would have to get your own Part D drug plan separately.
So once again, Medigap historically happened before Medicare C ever existed, because it was really designed to allow people to insure around the co-pays and the deductibles, which are part of Medicare A and B. So that was the point of Medigap, and remains the point of Medigap. So that's why Medigap doesn't involve with D. It doesn't involve drug plans, right? And of course, with Medicare A and B, there are unlimited providers as long as you find a provider that'll do Medicare, which is most folks, right? As opposed to Medicare C, where typically you're going to be having perhaps some more benefits, right? But also somebody who is your primary care doctor who is kind of referring you to who you're allowed to see, right? So you've got systems that are a little bit more limited. Does that make sense? Medicare supplemental is a Medigap plan. That's a Medigap plan.
So there are 2 types of plans you can join when you become Medicare eligible: Medicare Advantage, which we talked about, and Medigap, which is the Medicare supplement.
Right, because the Medigap is because you're on A and B, so you're insuring to take care of those deductibles and the co-pays that are required under Medicare A and B. See, does that make sense? Really important distinction. Folks get that confused all the time. Yes, your friend. Wait a minute. Oh no, this person had raised his hand originally. Yes, sir.
I just want to make sure I'm getting the basics here. My takeaway from this is if you have an employer-sponsored plan, it's like you have different options you can choose from, which would be Medicare Supplement or Medicare Advantage. You really have to go down and look at the benefits that are available on each of those plans to determine which one better meets your needs. And I'm new to Medicare, but when I looked at it the first time, I don't know if it's a generalization or not, my takeaway was hospitalization benefits generally were better under the Medicare supplement plan, but there were broader benefits available under the Medicare Advantage plan. Is that a general?
I'll answer a couple of things.
So can you repeat that question also just for the camera? Right.
Sure. So one of the things you mentioned is better. We don't like to say benefits are better. They might be richer. So with what you just said just now, with Medicare Supplement or Medigap, there's no co-payments for anything beyond a deductible. So let's say you have the Medicare Supplement or Medigap plan that has no deductibles, just has zeros for all the co-pays are 0 all the way down the line. So if you were to be hospitalized, You wouldn't pay anything. You're just paying the monthly premium for the plan. Okay, does that make sense? You also mentioned group-sponsored or employer-sponsored plans. If anyone's on an employer-sponsored plan now and it's ending maybe for one reason or another, you're turning 65 or you're retiring, I think this is what you meant. It's great. It's a great idea to come to these and kind of see what the carriers are offering, because this is what you would replace what you have now with. You would join a Medicare supplement or Medicare Advantage individual plan rather than have a plan through your employer. Does that make sense? Is that what you were saying? You had an employer-sponsored plan right now, or?
I'm already retired.
Okay.
So I'm already in an employer-sponsored
All right.
Medicare supplement.
Okay, so you're on an employer-sponsored Medicare supplement plan. Okay, so there are some differences with that plan versus what we offer on an individual basis. It's still called Medicare supplement or Medigap, but the difference is, I can talk to you afterwards a little bit. There are some differences between employer-sponsored and what we sell, which is the individual plan.
I don't want to go there yet.
There's a lot of, I'll talk to you.
Yes, sir.
You know who I am, don't you?
Yes. Well, but I'm still going to say sir, for God's sake. It's one of those.
He's a great guy.
As an ad.
The first thing I want to say is, if you're not from Northborough, but you have Verizon, I don't know what Charlie does, you can still watch this on cable, because in like Westwood, they have 24, 26, 28, that covers Northborough, and some, in fact, you get London and stuff. So if you're not from here, you can still watch this rerun if you have Verizon. I don't know about Charlie, they may, I just don't honestly know. I remember, the question I have is about, politicians talk about Medicare for everybody. I don't think they realize what's involved in that. Not aware that when I started selling group insurance, which I did for 30 years, the plan was $100 deductible, 80% of the next $500, which meant if you had a $100,000 claim for the year, you would pay like $500, $600 out of your pocket. And when HMOs came in and all that, and all the insurance companies left because of the regulations, that's the problem. It's not has nothing to do with this, but Medicare for all, what impact would that have on the whole system if the government takes it over?
I'll do that one. There you go. This is a Republican questioning with a Democrat answering. The question is if Medicare, the question is if Medicare for all showed up, right, then how would it affect all of this, right? And the answer is, as we've seen from TV, we have no clue what Medicare for all means, right? No clue, right? So we just have no way to figure that out. And boy, if Medicare for all means that there's only one plan and the government's got the plan, that this could be a pretty expensive system. I think Democrats and Republicans can agree on that, right? This would be a very expensive system, but we're like clueless on what that might what might happen, right? And the comment was, anytime the government gets involved, it usually costs more. So I won't go to that one, because I remember that debate about when Obama was always talking about the fact that Medicare, in terms of administrative costs, was actually cheaper than all the private insurers. But I won't go there because we don't want to be political. Thank you, Mr. Drury. Any other questions? Any other questions? Yes, ma'am.
I believe you said that as of 2019, that you can, beginning January 1st, you can change Advantage plans once?
Just once.
Once within the year, or once?
You would have the opportunity to change it once from January 1 to March 31st, and that would carry you through the rest of the year.
So for the year you can change?
It would change your plan. It would change your plan for the rest of the year, but we can't accept an application or change form after March 31st. Oh, I'm sorry. I don't know. You're correct. So we're hoping it's every year. The government told us last year that they were doing this year. I'm expecting it to be an annual thing, but every indication would say yes, but it's the government. They could change whatever they want.
Which I suppose makes sense, because that way, if you were shopping in the fall, and you said, okay, I'm going to take this leap, I'm going to go from Medicare A and B, I'm going to try a C plan, but then you got onto it and you were like, whoa, I goofed. This gives you one chance, kind of among private sector entities, to change from one private sector entity to another in the spring.
As I'm just coming into it, since I'll be 65 next month.
Oh, God, I wish I could remember 65. So young.
Doesn't feel that way.
Wait till you feel 69. I'm not going to go ahead.
That as a new enrollee, that I have a different time frame for making a change, is that correct? That would be.
So your birthday's in April, not the 1st? Okay, if you were the 1st, you could actually go back a month. You'll be eligible for A and B on April 1st, and that means you can join a Medicare Advantage or Medicare Supplement plan on April 1st. That will
As
carry...
well as A and B.
As well as A and B. You would have to be on A and B, right. So you would get A and B on April 1. You could join a plan on April 1, and that would carry you to the rest of the year. And then remember I talked about that open enrollment period or the annual enrollment period at the end of the year? That's when you would make a decision whether you want to change to a different carrier or a different plan for January 1 of 2020. Now, when that happens, if you join a Medicare, let's say you join a Medicare Advantage plan for April 1, okay? You have that the rest of the year. Then at the end of the year, you come to a presentation and you say, you know what, I'm going to keep it. I'm going to keep the Medicare Advantage plan. Perfect. April or January 1, you would renew. You would be on the Medicare Advantage plan. Now, providing the government does it again, you're going to have the opportunity to change that Medicare Advantage to another Medicare Advantage from January 1 to March 31st of next year.
If I understood correctly, I was told that I have to have A and B,
Correct.
which apparently I do. I didn't even know I'd been enrolled until I got billed, which is very strange. Social Security apparently did it for me. But I was told I had until July 31st to decide what kind of plan.
3 months after you turn 65, correct. Yep, so you have 3 months before, the month of your 65th birthday, and 3 months after to make a decision, correct.
So as you can see, there's a lot of stuff. I need to stop because I want to make sure we're on time. All of us are going to be staying though afterwards in case you have any other questions. I want to thank you all very much for coming. This is obviously it's an important topic, a complicated one, but it involves a lot of money. The basic takeaway I'm just going to give you is you can change every year, and you owe it to yourself. You owe it to yourself to at least look to see whether any of these other plans make any sense. Thank you very much, and we'll see you next time. Thank you.
Thank you.